The trial was one part of my PhD, and it was a feasibility study. So we were mainly looking at, was it possible to carry out this research, both the trial and the intervention itself. We demonstrated that it was feasible in terms of uptake. So we had an uptake of about 50% of patients overall. It was acceptable to undergo the intervention during transplant. So that was importantly exercising pre-transplant, so between induction therapy and admission for transplant. Engaging and exercising with the physiotherapist during admission for transplant, and then afterwards in the rehabilitation phase, exercising independently at home but with telephone support from the physiotherapist. We also assessed a range of secondary outcomes in order to look at some effects of the intervention potentially, and so we measured patient-reported outcomes in terms of levels of fatigue and quality of life, and importantly, functional capacity outcomes. So we measured lower limb strength with a sit-to-stand test, 6-minute walk test. We measured objective physical activity, and we used a questionnaire to measure physical activity as well. And those measures, the analysis of those measures was a little bit limited because of the effects of the pandemic. So the trial started pre-pandemic and was very much a face-to-face, centre-based trial, and we were asking patients to travel in once a week to exercise in the prehab phase. And obviously with COVID that all had to change, and the study was amended to be completely virtual, where we recruited virtually and delivered the intervention remotely with physiotherapist contact over Zoom. And although that was disappointing to have to do that, it actually was really opportunistic. So we now have some feasibility data to say that it's also feasible to exercise myeloma patients remotely, which is important given the safety implications in terms of patients living with bone disease, significant bone disease, and feeling confident and safe to exercise remotely was really important. So we've got some data to show that that's worked. Yeah.